Now, 8th question. It looks too big. So what do? Suddenly, when I look at this question, my eyes went to prominent epicanthal folds. This happens to a lot of us, right? When we look at a question, when you see it's a huge question and you're already at the end of your block, say you're on your 36th question, you're really tired and you'll see something like epicanthal folds, low set small ears. That's it. That should tell you this is a very easy question. You can do it. So that's how you build your confidence before solving any question, right? It's not just about knowing the question. You should also be confident that you know the question, isn't it? So I'm directly reading the line. Physical examination shows prominent epicanthal folds, low set small ears, and a protruding tongue. This, even without preparing for your step 1, you know we're talking about Down syndrome. Now, why have they given such a huge question for Down syndrome? Now let's go back. A 43-year-old male is brought to the physician by his father. Over the past year, the patient has become progressively forgetful and withdrawn. We're talking about dementia. Okay. He frequently has trouble remembering names of acquaintances and has been requiring increased amount of assistance with getting dressed, cooking, and personal hygiene. This is where they want to waste your time. They could have just given he's forgetful and trouble remembering names, right? But no, they will give you he has a problem with getting dressed, cooking, just to make it more tedious to read. Now, he was diagnosed with a genetic disorder during infancy. Infancy means it should ring a bell about Downs, Edwards, and Patu, which is your 13, 18, and 21. Okay. Now, like I said, prominent epicanthal, low set, small ears, and protruding tongue. Mental examination shows a significant deficit in short and long-term memory. So again, is dementia, again to waste your time. This patient's cognitive symptoms are most likely the result of which of the neuropathologic changes. So when I read this question, when I read dementia and when I read Down syndrome, I knew they're talking about Alzheimer's disease, because when you go to your neurology section and read about Alzheimer's, they have given there you can have an early onset Alzheimer, as in a younger age group below 45 years, in Down syndrome and certain APP gene mutations, that is an amyloid precursor protein. That is seen typically because amyloid precursor protein and Down syndrome affected is 21 chromosome, which are on the same. APP is also on 21, Down syndrome is also 21. That is why Alzheimer and Down syndrome go hand in hand. Even in your biochemistry section under Down syndrome, they have given early onset Alzheimer is seen in the patient. Right? So this is a typical presentation of that. Now they want us to check neuropathologic changes. Okay. Look at these options. Cytoplasmic inclusions of ubiquitinated TDP 43, multifocal deposition of excess copper, intracellular aggregations of alpha-synuclein, extracellular accumulation of amyloid plaques, synaptic buildup of abnormal prion protein. Right? Now, before going to the answer, I'll stay on this page and tell you how to solve this. Now, for people who have already read Alzheimer, who already know what is the pathology that happens in Alzheimer, I meant neuropathologic microscopic findings, you'll know what the answer is. Now, let me say that I haven't read, but I know other peripheral neurologic stuff. I'm getting confused between C and D. Let's say, okay, I'm getting confused between C and D. Now we'll see what to do about the question. Now, cytoplasmic inclusions ubiquitinated TDP43. This is seen in frontotemporal dementia, and I know it. Now, why cannot it be the answer? Because in frontotemporal dementia, the first presentation is more of a behavioral and social changes, not the memory sets in very later. That is the first symptom. So if they give you a question on FTD, which is frontotemporal dementia, you'll 100% have something related to behavioral, abnormalities. Socially, they're unaccepted. They act like they've gotten frontal lobotomy done. That's how the patients act. Okay. So, and later on, they'll have memory issues. In our patient, he has memory issues at the very beginning. So I'm going to rule out A. Copper, multifocal deposition of excess copper. We're talking about Wilson's disease here, isn't it? Wilson's disease, they should give you a case of Fleischer ring in the eye. Basal ganglia, some movement, basal ganglia is affected, then that means you'll have movement, ataxia, and liver disease, right? Ultimately, it's deposited in the liver. And it's also seen in younger patient. Okay, this is also a younger male, no problem. But the other things he doesn't have, right? So ruling out that. Intracellular aggregations of alpha-synuclein and extracellular accumulation of amyloid plaques. Now, I remember that I read in Alzheimer under neurology section something related to amyloid precursor protein. So there was an amyloid there. Yes. Then you'll start recalling there were neurofibrillary tangles we read about, amyloid plaques deposition we read about, the pink areas. This question can also be given as a picture-based, an image-based question, where they'll give you a pathology, picture of your nerves and everything, and then you would have never seen that picture. Trust me, there are such questions, and then you get confused. But they would have given these options, so you can match them. It's not that if you see an image-based question, you've never seen that image, you get tensed up and you're like, I have not seen this image, what do you do, and all that. You can always correlate an answer. Abnormal prion protein. Prion is a very interesting disease. It's called Creutzfeldt-Jakob disease. In that, very typically, first you'll see myoclonus. Forget about everything. Think. Creutzfeldt-Jakob is an acute, as in sudden onset disease. It's a sudden onset disease. Do you think this is sudden in onset? Congenital genetic, 43-year-old, now he's presenting it. If it was a Creutzfeldt-Jakob or prion disease, he'd have presented it immediately, right? So ruled out E. Now C and D is left. Like I said, I remember reading about amyloid precursor, so I'm going with D. Okay. Okay. Now alpha-synuclein, I don't know how many of you remember, it is seen typically in Parkinson's and Lewy body dementia. These two are hand-in-hand question. Parkinson and Lewy body dementia, they'll mess up your brain and you'll mark the wrong answer. So again, there are some clues which it says it's Lewy body and not Parkinson. Okay, so the question is not related to Parkinson, so I'll not tell you what it is, but so what I want you guys to know here is how to dissect it, how to understand that this was Alzheimer, they're talking about Down syndrome, and I've read about APP gene, so it's amyloid plaques. Even if you have not read about amyloid plaques, you can still answer this question, right? Because I'm pretty sure when you have read Alzheimer, you would have read about APP gene, right? And okay, forget about Alzheimer. If you would have read Down syndrome itself, there you would have read about APP and Down syndrome. So this is how you can still solve questions. Okay, so these are the underlined ones which I already mentioned. Okay, and here you go. That's the answer. Extracellular accumulation of amyloid plaques. Now, so what did we learn here? Okay, let's go back. So prominent epicanthal and Down syndrome, that was a memory-based question, and I think it's a very universal question. You will have one question on Down syndrome, so better learn Down syndrome properly, right? And you see a lot of American patients with Down syndrome, very common in the Western world, Western part of the globe. And pathology, yes, 100% it's related to pathology because we learned about the microscopic changes of your neuropath, correct? So this question can be also presented as an X-ray, as a CT question or an MRI question for especially frontotemporal dementia, which is your option option A. That can be given as an X-ray question. And excess copper, they can give you an eye picture, but I'm not sure they'll be so good to you by giving you an eye picture and okay, you'll be like, okay, that's Kaiser Fleischer-Ring and let's go with Wilson's. So yeah, I think prion protein also, they can give you the staining and all that. Okay, this can be an image-based question as well.